Question 1. A patient is prescribed gentamicin. Which assessment finding is most concerning? A. Muscle cramping. B. Headache. C. Tinnitus. D. Nausea. Answer: C. Tinnitus. Question 2. What is the nurse's priority when administering 4-magnesium sulfate? A. Monitor oxygen saturation. B. Assess bowel sounds. C. Check capillary refill. D. Evaluate blood glucose levels. Answer: A. Monitor oxygen saturation. Question 3. Which finding indicates effective teaching for a patient taking albuterol inhaler? A. I'll use it routinely twice a day. B. I'll use it before exercise if needed. C. I'll stop taking it if my heart races. D. I'll clean it once a month. Answer: B. I'll use it before exercise if needed. Question 4. What is the most important assessment before administering amlodipine? A. Heart rate. B. Pain level. C. Respiratory rate. D. Blood pressure. Answer: D. Blood pressure. Question 5. Which adverse effect of propylthiouracil should the nurse report immediately? A. Nausea. B. Sore throat and fever. C. Drowsiness. D. Weight loss. Answer: B. Sore throat and fever. Question 6. Which action ensures safe administration of 4-promethazine? A. Administer undiluted in small veins. B. Infuse through a large bore force slowly. C. Push rapidly to reduce nausea quickly. D. Mix with potassium chloride. Answer: B. Infuse through a large bore force slowly. Question 7. A patient on hydrochlorothiazide reports muscle cramps. What lab should the nurse check first? A. Calcium. B. Sodium. C. Potassium. D. Magnesium. Answer: C. Potassium. Question 8. A nurse teaches a patient taking clonidine. What indicates understanding? A. I will stop the medication if dizzy. B. I should take this at bedtime. C. I can skip doses if my blood pressure is low. D. I should stop abruptly if side effects occur. Answer: B. I should take this at bedtime. Question 9. What is the nurse's priority teaching for a patient prescribed bisacodyl suppository? A. It should be taken with meals. B. It may take several days to work. C. Avoid long-term use. D. Use a heating pad if cramping occurs. Answer: C. Avoid long-term use. Question 10. A patient is prescribed erythropoietin. What finding requires immediate intervention? A. Increased appetite. B. Blood pressure 180/100 mmHg. C. Fatigue. D. Hemoglobin of 10g/dl. Answer: B. Blood pressure 180/100 mmHg. Question 11. What is the nurse's priority teaching for a patient taking raloxifene? A. Take with calcium-rich foods. B. Monitor for leg swelling or pain. C. Take it with food to avoid nausea. D. Discontinue after 3 months. Answer: B. Monitor for leg swelling or pain. Question 12. Which client statement requires clarification when taking nitrofurantoin? A. I will take this with food. B. I will finish the full course. C. My urine may turn brown. D. I can stop taking it when symptoms improve. Answer: D. I can stop taking it when symptoms improve. Question 13. What finding indicates potential toxicity of sodium nitroprusside infusion? A. Reflex tachycardia. B. Nausea and vomiting. C. Hypotension. D. Altered mental status. Answer: D. Altered mental status. Question 14. A nurse teaches about acyclovir. Which statement needs correction? A. I will increase fluid intake. B. This medication cures herpes. C. I will report any rash. D. I will complete the full course. Answer: B. This medication cures herpes. Question 15. What should a nurse prioritize when caring for a patient taking cisplatin? A. Monitor respiratory rate. B. Assess bowel movements. C. Monitor urine output and renal function. D. Assess oral mucosa. Answer: C. Monitor urine output and renal function. Question 16. Which lab value is most important to monitor for a patient on heparin? A. Hemoglobin. B. Hematocrit. C. Platelets. D. Point/INR. Answer: C. Platelets. Question 17. What is a priority nursing action for a patient receiving naloxone? A. Provide oxygen. B. Start a second 4-line. C. Position the patient supine. D. Prepare to administer an antihypertensive. Answer: A. Provide oxygen. Question 18. What adverse effect should the nurse monitor in a patient taking diltiazem? A. Tachycardia. B. Hypertension. C. Peripheral edema. D. Urinary retention. Answer: C. Peripheral edema. Question 19. Which instruction is essential for a patient prescribed colchicine? A. Take with grapefruit juice. B. Take with large meals. C. Stop the drug if diarrhea occurs. D. Expect increased urine output. Answer: C. Stop the drug if diarrhea occurs. Question 20. A nurse prepares to administer for metoprolol. Which assessment is priority? A. Respiratory rate. B. Pain level. C. Apical heart rate. D. Urine output. Answer: C. Apical heart rate. Question 21. What is the priority teaching for a client starting phenytoin? A. Stop the drug if your gums bleed. B. Expect weight gain. C. Report rash or skin changes. D. Take on an empty stomach. Answer: C. Report rash or skin changes. Question 22. Which client finding is most concerning with morphine use? A. Constipation. B. Sedation. C. Nausea. D. Itching. Answer: B. Sedation. Question 23. A nurse gives an initial dose of benztropine. Which finding requires follow-up? A. Dry mouth. B. Urinary retention. C. Drowsiness. D. Blurred vision. Answer: B. Urinary retention. Question 24. A patient is prescribed ketorolac. The nurse should monitor for which serious side effect? A. Diarrhea. B. Hypertension. C. GI bleeding. D. Muscle cramps. Answer: C. GI bleeding. Question 25. What is a priority teaching point for a client on acarbose? A. Take this after meals. B. Take this with the first bite of food. C. Skip doses if you miss a meal. D. Double the next dose if skipped. Answer: B. Take this with the first bite of food. Question 26. The nurse prepares to administer epoetin alpha. Which finding would cause the nurse to hold the dose? A. Hemoglobin of 12G/DL. B. Hemoglobin of 8G/DL. C. Blood pressure of 160/94 mmHg. D. Pulse of 80 BPM. Answer: C. Blood pressure of 160/94 mmHg. Question 27. What is the priority action after administering naloxone? A. Administer oxygen. B. Monitor for respiratory depression recurrence. C. Place the patient in the supine position. D. Provide a second dose immediately. Answer: B. Monitor for respiratory depression recurrence. Question 28. A client is prescribed sulfasalazine. Which teaching point is essential? A. Take on an empty stomach. B. Your urine may turn orange-yellow. C. Avoid dairy products. D. Stop taking if mild nausea occurs. Answer: B. Your urine may turn orange-yellow. Question 29. What adverse effect should the nurse watch for in a client taking valproic acid? A. Constipation. B. Hepatotoxicity. C. Muscle cramps. D. Tachycardia. Answer: B. Hepatotoxicity. Question 30. Which finding would prompt the nurse to question the use of metoprolol? A. Heart rate 55 bpm. B. Blood pressure 128/82 mmHg. C. Respiratory rate 16. D. Temperature 98.6 degrees Fahrenheit. Answer: A. Heart rate 55 bpm. Question 31. A nurse teaches a client prescribed methimazole. Which statement requires further teaching? A. I will report fever or sore throat. B. I can stop the drug once symptoms improve. C. I will take the medication at the same time each day. D. I will have blood tests to monitor therapy. Answer: B. I can stop the drug once symptoms improve. Question 32. What is the nurse's priority action before administering filgrastim? A. Check liver enzymes. B. Assess for bone pain. C. Check WBC count. D. Monitor blood glucose. Answer: C. Check WBC count. Question 33. A patient taking prednisone long-term should be monitored for which complication? A. Hypoglycemia. B. Hyperkalemia. C. Osteoporosis. D. Weight loss. Answer: C. Osteoporosis. Question 34. A patient taking lithium develops vomiting and diarrhea. What is the nurse's priority action? A. Withhold the lithium and notify the provider. B. Give an antiemetic and continue lithium. C. Increase fluid intake and continue lithium. D. Give the next dose with food. Answer: A. Withhold the lithium and notify the provider. Question 35. The nurse is teaching about rifampin. Which statement indicates a need for further teaching? A. I will take it on an empty stomach. B. I will use a backup birth control method. C. I will avoid alcohol. D. It will permanently stain my teeth. Answer: D. It will permanently stain my teeth. Question 36. What is the nurse's priority assessment before administering formanitol? A. Lung sounds. B. Heart rate. C. Pain level. D. Urine glucose. Answer: A. Lung sounds. Question 37. A client taking tamoxifen should be taught to report which symptom immediately? A. Hot flashes. B. Nausea. C. Vaginal bleeding. D. Mood swings. Answer: C. Vaginal bleeding. Question 38. What is an expected adverse effect of pyridostigmine? A. Dry mouth. B. Increased muscle weakness. C. Increased salivation. D. Constipation. Answer: C. Increased salivation. Question 39. The nurse should question which order for a patient allergic to aspirin? A. Acetaminophen. B. Celecoxib. C. Diphenhydramine. D. Loratadine. Answer: B. Celecoxib. Question 40. What is the nurse's priority action after administering alteplase? A. Monitor blood glucose. B. Monitor for bleeding. C. Assess lung sounds. D. Assess for nausea. Answer: B. Monitor for bleeding. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.